Oh, okay.
Not sure if I
I mean,
right.
No. So you know what? I can advance that for you. Let me pull up.
Everybody works. And I had to sync up to each of them.
Good morning.
Good morning. It was a. There were times. I'll be cheap today. To walk across the street from my one.
Some of them, they'll, I'm sorry.
I had to go home. What's freaking. Yeah, that's me, because give me a uniform, that's why I started with my girl.
Ordering.
I can't even.
So ordering the food, set up where the guys can wait in order based on what they're allowed.
So they get allowance and then they go and they order off the allowance they get. What they. You don't make a difference. I'll make it on service. That's
Fire
already.
alarm,
Fire alarm?
somebody can put it on two gas stations on the third floor.
I've already. I've already accepted that. I just stopped. I won't, it's pretty. It's ultra jet. It's far from just don't look right out. Let me start. I'm already just dash. We just check it over.
Front door didn't work right. I don't know.
That's the elevator. The fire alarm wasn't working. Yeah, working. Yeah. I have actually. Somebody that's like, I've gone into our iCloud.
Your family gets a new device and they're like, oh, I'm gonna sign into my email.
There's security cameras in there. Why? But when I was there, security said they were, why? Security cameras working.
External content, yes, we do have.
Hasn't been.
Meanwhile, my dad.
Like, that's weird.
Yeah, they got ordered for it. Oh, I didn't know. I set up all my own.
Then I found out the back door, somebody super glued his line. So they can let the friend.
I was in charge of wiring up the whole home.
Everybody was sitting out there, oh, and then everybody was.
Okay, so that's one hurdle. Excellent.
Goodness. Some paste this camera low down. And you're probably going to know. Get the file, discuss it, and take it out.
So I am sharing the screen video, so,
So I think why it's saying that is I have an embedded video,
okay. Did you do
which is really great, so hopefully.
It's a very, that's what he said. You start celebrating too. I was like, yeah.
Let's see.
Said you gotta do something.
You do live?
Whatever.
Huh?
Yeah, she did.
Oh, yeah. Send it
I looked in mine and said 83 cents. I walked back out. I was like, I'll make it another day.
It just used to be, it's just awesome. Yeah. Okay, so is this everyone we're expecting from, like, is Mike not coming?
I'm not sure.
Okay.
Probably not.
Okay, well, I think we've waited, we've got a few minutes, in, so I think we're good. We have technically a quorum of the safety committee right now. Cecilia, Kyle, Mr. Lambert, myself, so I think we can call the meeting to order. So I am recording this meeting because we'll make it available on our YouTube channel for the safety committee. That way, anybody who wants to access it can. It'll become part of our onboarding, hopefully for new employees moving forward. So just to do a brief introduction, this is Tracy Behringer. I am so glad that we're finally able to do this because Tracy and I have been communicating since, I want to say, maybe even last summer.
Possibly.
To try to get this scheduled, and it's just been a challenge, but I so appreciate her being here. Tracy came highly recommended by Senator Kamida's office, actually, for this training, and I'm just going to let you take it away.
Okay, well, thank you. Thank you so much, and thank you all for having me today. My name is Tracy Behringer, and I am the Community Liaison for Outreach and Education from Chester County's Office of Mental Health. I have been working in mental health in Chester County for about 20 years, more in a public health education capacity, putting together presentations like this. I'm also a certified mental health first aid instructor. Anyone ever heard of that class? Mental health first aid, have you taken it?
I took a little bit of it back in college, but I don't think I finished it.
Okay. Yeah, that's an international certification program. It's kind of compared to Red Cross first aid, but it's mental health first aid. And we offer it through the county at no cost to participants. I'm also on our Chester County Suicide Prevention Partnership and certified QPR, which is Question, Persuade, Refer. That's a suicide prevention training. And so I've been, presenting that in the community as well for about 20 years. So I'm delighted to be here this morning. I live in Westchester now, but I raised my kids in Coatesville. We lived here for about 25 years. And I really do love the community. It's such a great, tight community. I felt like when I moved here, I knew everybody, and just through the schools and the sporting events. So it's good to be back. I really appreciate it. So this is, am I going to be able to see the slides?
Yep.
Okay. So this is a presentation that we have put together and kind of, it's on the shelf, something that we sort of keep updating as things do update in Chester County. There, mental health has been pretty much a hot topic for a while. There's been a lot of cool things that have happened in our Office of Mental Health and Human Services. So I'm happy to talk to you all about some of that stuff, but really this presentation starts with just some basic information about mental health. A lot of times the audiences that I have for these presentations, the degree to which people, have had experience with mental health or have had training or understanding about it varies wildly. So I kind of start with some of the basic information, and I try to make it sort of conversational so that if I am giving you information that you're like, no, we've had all this, we know all this stuff, then I can sort of, get through that quickly or skip anything that you feel like you have a good understanding of. But this presentation is called Mental Health, Get the Conversation Started, so you can guess that it is kind of starting with some basic stuff. So the next slide. So this is just kind of an overview of what we're going to cover in about an hour. Just like I said, general overview about what is mental health, some of the impact, the prevalence of mental health, some risk factors, what makes someone have a greater chance of possibly developing a mental health condition or challenge. Talk a little bit about that, when someone might want to think about getting help and how do you do that, and then Chester County resources. And fortunately there are a lot. So you can go on to the next slide there. All right. So basic. basic. What is mental health? Well, it is definitely equal to our physical health. It is a fundamental part of our overall health and well-being, and it really does impact every aspect of our lives, right? I'm quick it again. It also helps determine how we handle stress, all that good stuff, and some statistics about it. In public health, that's how we measure a lot of things. What's the data? So that top stat there is relatively new. It's from the CDC, that more than half of us in the US will develop or be diagnosed with a mental illness or disorder at some point in our lifetime. So I always like to put that out there right away, because sometimes when I would be asked to speak about mental health, it was almost as though the people asking for the information was kind of like, well, how do we talk to or handle them? But it really is all of us. All of us have mental health. All of us have our struggles. Mental health is so fluid, so we all have good days and bad days, right? And someone can have a diagnosis, but then recover. So it's not something that's a lifelong condition. Mental health, like I said, it's very fluid and very common. Some other stats are in the next clip. Yeah, these have been around for a while. 1 in 5 American adults at some point in their lifetime. Depression is the leading cause of disability worldwide, and that has been a pretty stable stat for many, many years. It's not just in the US, depression, anxiety, mental health conditions obviously affect everyone. And then this last bit of information here, half of all mental health conditions develop, when kids are just starting out, in puberty, just, 14, by age 14, half of all mental health conditions will develop. So we used to think that it didn't really impact kids quite as much, but today we know that there actually is a mental health it's somewhat of a crisis among young people in our country today. And there are a lot of different reasons for that. We could actually have a whole program on it. Mental health first aid actually covers a lot of that stuff. But important to know, it's common, it's diagnosable, and if something's diagnosable, there's treatment available and recovery is possible. Very important to remember. So next slide. Any questions on this so far? It would be conversational. Please feel free to ask if you have a question or, if something's not clear, whatever. But there are many different things that can impact, if someone's going to have a higher risk of developing a mental health condition. There's never one single reason why it happens, why someone may develop a serious chronic mental health or mental illness, or just have different struggles throughout their lifetime. But there are risk factors. So the first and most significant is trauma. And hopefully the next slide is a short video clip that will kind of explain that more and talk a little bit about ACEs. Does anyone know what ACEs stands for? Have you ever heard of ACEs? No? So ACEs stands for Adverse Childhood Experiences. And it is, it truly has a very significant impact on our lifelong health and well-being if we have had, or how much adversity we have had in our childhood. Adverse childhood experiences impact the person lifelong. And this information about trauma and how it affects us from childhood through our life really resulted from a study that was done about 30 years ago It was a huge study that really, it's so surprising that more people don't know about it. If you are familiar with ACEs, it was a groundbreaking study of more than 17,000 people who were using Kaiser Permanente health insurance. And so they looked at 17,000 mostly middle-class, well-educated adults, and they asked them questions about adversity in their childhood. They asked them a set of 10 questions, when you were a child, did you ever have or experience neglect or abuse, physical abuse or sexual abuse? Was someone in your household using substances or abusing substances? Were your parents together? Were they divorced? Was a parent incarcerated? And what they found from this study and surveys is that most people have experienced adversity in their childhood. More than 60% had at least one ACE identified of these little questions they asked. They also realized that the more adversity someone had, the greater their risk for developing not just mental health conditions, but physical health conditions lifelong. So, and there's sort of a dose response to this adversity. So if someone did experience neglect, abuse, maybe lived in poverty, maybe had other traumatizing, dysfunctional things at home, the more of that they had, the greater the risk for developing diabetes, asthma, cancer, all kinds of physical health conditions, as well as possibly anxiety, depression. And what they also found is that people who had 6 or more of these adversities that they identified in their childhood generally have a 20-year shorter lifespan. Yeah, shocking. That's why I'm like, why didn't they get this out there? More people should know. A lot of teachers had never heard of the ACEs study, and that truly going to impact some of their students. Some physicians aren't aware of the ACEs study, but it has been around, documented, and hopefully our video will play, because that gives you like a good base. But other things can increase our risk, our genes, our family health history, right? If people in our family, if our aunt and our mom and our grandmother had heart disease, that would be something we want to know about. It's part of our health history. And so we might do things to help prevent or to manage, perhaps having a heart condition. Same with mental health. If we know that people in our family have had depression or anxiety, our risk is a little higher. It's in our genes. So that's another thing that may come into play. Biology, if we have another medical condition or a chemical imbalance or hormonal dysfunction, any of those things can add to the risk. Our environment, where we live, and that can be in the home, like I said, for any kind of dysfunction, or in a very well-run, loving home. That can have a positive effect too. Our lifestyle has an impact on our mental health. So any of these things can play a role. Does anyone have any questions about any of that? Have you heard it before? Not too surprising. So let's see if we can get that. My fingers crossed. This is
Oh, no, sorry.
it's 5 minutes long. Yeah. I don't sound, yeah. It's complicated. Okay. So that's, really a quick overview of ACEs. But does anyone have any questions or thoughts or comments about that? Surprising, right? Kind of, like I said, it was, really a groundbreaking study that you would think, everyone would be aware of, but not necessarily. So it does, trauma, as I said, is the most significant risk factor for someone developing a mental health condition, or, it's obviously something that can affect our physical health as well.
Tracy, I have a question.
Sure.
Given kind of some of the background on ACEs, are there any sort of assumptions that we can make about a city like Coatesville and kind of what some of the challenges we might have in this community?
Well, I mean, I think, as I said before, I lived in Coatesville for 25 years. My kids went through the whole school system from start to finish. So I'm familiar with the community. And I know that there are some social concerns. Anytime someone has, struggles with low income, with poverty is really a traumatic experience too. Any kind of, social concerns that a community has probably means that there are going to be community members who have higher ACEs, if there are those conditions in the community. Is that what you mean?
Yeah. I mean, knowing that the city itself has about 20 to 30% poverty rate, certainly majority minorities, so, lower access to healthcare. We don't have a hospital nearby.
Right.
So we have what it seems like, several kind of those indicators of ACEs, and, being a city staff that works in the community, kind of what should we expect?
Right. I think, one of the most important things when you're interacting with the public, and there are certain sectors, or, sometimes when I'm out talking to offices or even businesses, there are specific individuals that are kind of regulars. Even the library, sometimes they're like, we have folks come in because they're home, they don't have a home, and it's cold out. And so, sometimes they want to know how to, just how to best interact with someone, how to, give the most positive experience for someone. And so, that takes understanding and sometimes courage to have, awkward conversations, but just also being aware of the resources that are available, and I'll talk a little bit more about them. Very important in the Coatesville area is the ACEs Coalition. I'll talk a little bit more about that at the end. Chester County does have an ACEs Coalition, and they provide free trainings for, again, for offices like this one, how to be more trauma informed, how to understand when maybe you've been trying to help someone or working with someone, and it doesn't matter if it's professional or someone in your family or your next door neighbor. A lot of people have struggles and trauma. And so just understanding that what they said in that video, sometimes if the adversity happens in childhood, it does disrupt our brain function. This is brain science, they've studied it. So it isn't like someone just makes bad decisions. They make a bad decision possibly over and over for a reason. And that's because of their life experiences and how they handled things in the past and how their brain now functions. It's not permanent. As they said, what is predictable is preventable. And the ACEs Coalition, and they're in Coatesville pretty often. I'm also in that coalition, just providing information, handouts. They're at a lot of events in town, they have display tables, that sort of thing. So they're definitely all about educating. I think if people understand more, they can, be more helpful with the public or, just offer better information, resources, and help, when someone needs that. Does that answer your question? I'm not sure if, okay. I will give you the information to the ACES Coalition, and they're wonderful. So another measure of mental health in a community are things like suicide. We look at suicide statistics to see how, how are things going? Are we having a lot of loss to suicide? And unfortunately, suicide has been on the rise in this country for 2 decades at least. We use this visual of Citizens Bank Park. You all recognize Citizens Bank Park, and the capacity there is 43,647 people. Click it one more time, you'll see that, the latest statistics in the United States, which they do lag a little bit. So this is 2023, we'll probably have an update soon. It was almost 50,000 American losses to suicide that year. That number is the highest ever reported. It has been considered a public health crisis for years. But again, as I said, Chester County has a suicide prevention partnership, and we do a lot of trainings for suicide prevention and teach people how to recognize the signs, how to ask the question, and how to provide help. So, we are really doing a lot of work in that area. Before the pandemic, things were kind of leveling off a little bit as far as suicide statistics. But unfortunately, since it's kind of spiked again.
I have a question.
Sure.
Is that number broken down into like military veterans, first responders?
All the demographics, yeah. They do, as much as they have that information, yes. And there are people who, just like someone who may have a higher risk of developing a mental health condition, there are people who are at a higher risk of, attempting suicide or taking their life. And that's some of the information we teach. So the more informed the community is, the more helpful they can be and sort of offer that help to someone.
I was just asking, sometimes people see the numbers,
Yeah.
don't see the breakdowns.
Right. Well, there's so many things. So the demographics, so we know that gender plays a role. Do you all imagine which gender has a higher rate? Men, right. And often, why do you think that is?
I don't know, but I just think they don't put the stress the same.
Right. Right. There are probably a lot of reasons, but one of the number one things is the means. Usually a more lethal means that men take. So firearms are the highest used method or means for taking one's life. And usually women may try something else, perhaps an overdose, something like that. That isn't always lethal. The fact is that women attempt more than men. But men,
Not as successful.
right, although we hate to use successful, I know, you gotta watch. It's always something. But it's true that, young people are considered higher at risk. You figure they have a less life experience. They have less information. They may not know, some of the resources and who they can talk to. But also older adults are looked at as higher risk because of a lot of things they've gone through, perhaps more loss, perhaps more health conditions. There are a lot of different things that way. Different professions, veterans, active duty, military, people who are in the line of, well, experiencing more trauma, people who, first responders are at a higher risk, physicians, people who have very stressful jobs that can put someone at a higher risk. The breakdown for the demographics, it's very precise too, even, different ethnicities, all of that. That information is available at the Centers for Disease Control.
Yeah, I know for adolescents, they break it down to age groups.
Okay, sorry. Ages.
Suicide for adolescents, they break it down to age groups.
Well, yeah, I mean, we know that unfortunately suicide is the second leading cause of death for young people. Ages, and the statistic used to be 15 to 24. Now the stat is 10 to 34. So it's a 10, yeah, we're losing younger kids to suicide. I mean, I'm sorry.
Does that include kids under 18 too?
That's all ages, all demographics. That's the one big number, like you were asking. It does break down from there, but yeah. Yes, there, and the ripple effect from those losses is huge, because what we know about suicide loss survivors is they have experienced a trauma from that loss, right? So trauma can be a risk factor for someone attempting, and it's also a risk, it becomes a risk factor from someone who's had a loss. They've lost a loved one, someone they cared about, to suicide. So it goes both ways. Any other questions? So in Chester County, I'll just say that we sort of do mirror the national stats, obviously much smaller for our county, but as things have gone uptick, then so have our statistics. And when they were leveling off nationally, ours did as well. Go ahead. Yes. So when should someone, get help? They're maybe starting to notice that maybe they have some risk factors, and then they're starting to notice some red flags. And we all probably know a few red flags. If someone's been very sad lately, they feel like they're really struggling with their stress and anxiety. It's hard to manage. It's out of balance. That's why we have that illustration. So when things do get a little, overwhelming and out of balance, we all have bad days, bad weeks. But when it continues for a couple of weeks, when it starts to really have an impact on your daily life, that's when, people in the profession suggest you might consider getting some help. And there's a lot of different ways that you can start that. In Chester County, things just got a lot easier with the Human Needs Network. I would still probably, if I was telling someone, how to get help for mental health, I may still suggest you might want to go visit your family doctor, get checked out. Sometimes your physical health can have an impact on your mental health. You may call the number on the back of your insurance card, or look on some of the database websites that have therapists throughout the country, really. If you put in your zip code, you can find help relatively easy online. But in Chester County, if you're really looking for help, the Human Needs Network was developed about a little more than a year ago. It's been implemented in phases. It was a massive, overhaul of our county crisis response system. And the Human Needs Network now, you can see right there, comprehensive, effective, and accessible human services, crisis response, and INR services for everyone in Chester County. And it really comes down to two numbers, and 211 is one and 988 is the other. Are you all familiar? Has anyone heard of the Human Needs Network or to call these numbers? Yeah? I'm going to give you information to take too. Okay. So, starting with the 211, Like I said, it's a information and referral line, and it's part of PA 211, the logo down there on the right-hand side, the bottom. It's 24/7 available by phone. You can call or you can text. I know that and for a while, the texts weren't necessarily going to Chester County, but I think they may be now. You can text 211, but if you call them, you know you're going to get the people who are sitting at the phones in Westchester, and they have all the local resources. Again, it's 24/7, and they also go out in the community. You all have 211 mobile navigators?
The mobile crisis team stationed over the 700 block of East Lincoln Highway. So when you call, you have an average of 20-minute response.
Okay.
Once they're dispatched out, they will notify the county if they need assistance or if they don't. Usually it's just, hey, we're going out there, or you guys in the area, or we definitely need you because of the threat level that they are
Right.
assessing for. If the person says they have a weapon, then we're going right away. If they say there's candidates talking about having a bad day, they'll assess it outside, they'll try not to go inside.
Sure.
They have to go inside, but most likely just want us present. We use it a lot, and we've had some bumps in the road, but we've kind of ironed that out. So now that's well over a year, it's working. I would say it's an easily 90 to 95% success rate of a smooth transition from them to us and us to them to kind of get the help person needs.
That's great to hear. And right, there were going to be some bumps in the road. This is really stressful work, very important stressful work, but I'm glad that, it's kind of working out and it was all new, right? And a lot of the employees were all new. So it did take a little while to get everything, going smoothly. But I know the amount of community input and, just the amount of work that has gone into the Human Needs Network it's been very nice to see it sort of evolve because it has been so needed and it's so important. And I'm glad to be are you with the police?
I was a policeman, yeah, I'm Sergeant Andrew. I never the patrol division, which is obviously flying here today. The main bulk of the road was just communication and training.
Right.
My guys are heavily trained in the mental health field. We have several guys that deal with crisis intervention specifically. But we had a couple of incidents in the beginning, probably the first couple of months that it came to fruition, due to the fact that it was probably a training thing on the mobile crisis team side, just not getting everybody up to speed on how to deal with it, because I think they were getting a lot of new employees that had to get on board in actual battle scenarios. And other ones that we had like, all right, you're done, you gotta take it, and then we kind of coach them up and let their from command staff, let them know our observations and what we were feeling about it. So after a good 6 months, we started to get that ironed out and the communication was.
I'm glad to hear it. And you have to think the mobile crisis team that's here, and they are located throughout the country. So I wasn't really to the mobile team yet, but they're everywhere. They're everywhere in Chester County, and every community is different. So they're adapted to every community too, right? So it's a big job. Can be very stressful, and a lot of things to work out. But after a year, I'm hearing mostly good things, like you're saying.
Yeah, after the initial rollout, communication between them, county to us, and all the way through, kind of had to get ironed out. That was a big hurdle that we had to get through. Some frustrations were sad, and that's how we kind of got into it.
Good, I hear that. So, this is, if you walk into the contact center in the Government Services Center, in the Human Needs Network, on one side of the room are the 211 call takers, on the other side is 988. And 988, really, they all can communicate to each other, but this is more the INR line that we're talking about now. I have more information on, the crisis side in the next few slides. But It's available in the community. They are called mobile navigators for the 211. And you'll find them, they may be at the Coatesville Library, but they also go to the Exton Library, Kennett. They go to different locations throughout the community. And if you would like a mobile navigator to come out and talk to people about, you know, things that are available through 211, they will do that. So they have a centralized database with all kinds of resources. And these are mostly for, for home insecurity or food insecurity. If someone needs assistance with their rent or mortgage or utilities, if they're looking for meals, whatever kinds of daily living needs they have can be addressed through the 211 informational referral. And we do have a lot of great organizations and resources available in Chester County. So contacting them can give you all of that in one place. I think there's a couple more. Yeah, it's responsible for all of the PA 211 calls, and that's that little logo there. That's part of the whole statewide system. And then the 988 side, and that's the side we were talking about that kind of goes with the mobile crisis. I'll get to that on another slide, but yeah, you can go ahead and click through, I guess. So there are, of course, this again is 24/7, 365 days a week. It's never closed. It is suicide crisis line with trained counselors. And there, again, in Chester County, if you call 988, you're going to get a local response. And they're also in that same building there are peer-run warm line. That's if someone is not necessarily in a crisis, but really just stressed out, upset, and wants to talk to somebody who will listen. And you can call that warm line. I have the number on another slide. That has hours of operation, but it's used quite a bit. It's a very good resource people utilize. And then the 988 side, when someone calls, and if someone calls 988, you may call for yourself, for your friend, for the person standing next to you. I have a whole slide on when you should call, but one of the things you may talk about with the crisis counselor is, do you want to have the mobile crisis team dispatched? And that's the mobile unit that the officer is talking about. So, when should you call? This is where I click through it. Anytime you need support. So here are some examples, right? If someone's just overwhelmed, at any age, if it's a high school kid who's really overwhelmed, a university student, anyone can call when you're just wanting to support someone else, when you're lonely. A lot of times those are the calls, someone is just despondent. They don't feel supported. They feel alone and isolated. If they're having thoughts of suicide, just if you want to talk, they're having thoughts of hurting anyone. And again, if you're looking for local resources, you may go through 988, or they may sort of do that warm handoff to 211 if they determine that's for what you're looking for. Does anyone have any questions about that? I pulled some of these slides from a presentation that the crisis counselors sometimes provide in the community, and they give sort of a step-by-step process of what happens when you call. So first you get this automated message when you dial 988, and you can press 1 if you're a veteran. There's another one for, if you need Spanish or another language too. And then there may be a brief hold time while you're connected to the crisis worker. And that's going to be just, talking through things with them, sort of a triage The crisis worker will listen and kind of help the person who's calling identify ways to get help. And just kind of talk through their feelings a lot of times. The calls, I believe some of these are on the frequently asked questions, but they're all confidential. All of the crisis counselors are trained, and all of the ones, and I've met quite a few because I really wanted to find out, what do you do in this case? What do you do if someone asks this? And they are all so competent and caring, and very happy to help someone who calls anonymously as well. I loved this slide that they had in their presentation, and I sort of stole it too. Crisis workers won't steer the ship, but they will provide the light to help you navigate. So very important there. Crisis worker will provide any resources or referrals, and they'll connect people with other agencies. We have a lot of different agencies in the area. Not quite as many hospitals, but we do have them. We have Valley Creek Crisis Intervention, that's a walk-in center, and crisis residential also in Exton. Okay. They can also, sort of talk through and decide, do you need the mobile crisis? And here's some information about the mobile crisis team. As I said, they have satellite offices or satellite places where they are stationed throughout the county, because when you call, if you're in Coatesville and they're all the way in Westchester or Phoenixville, it's going to take a lot longer to get here. But having them in different areas in different parts of the county makes it easier and quicker. Teams are available around the clock. Although what I did want to say about the call takers is more than 90% of the calls to 988 are handled on the phone. So it's not always the case that you need those dispatches. But a lot of times just talking things out, getting connected to help is what the person needs. But this is also, a great tool. And sometimes people want to see someone in person. They want to have someone come out and talk to them. I've talked to some of the mobile teams, and I know that they try to match teams with the situation. If there are veterans who are on the mobile crisis teams, they will send them out if a veteran calls, so that they have more of that shared experience and understanding. And that's been very helpful too. Teams do not show up at someone's house with the siren going or a van or, anything like that. They drive a regular sedan. I'm sure you've probably seen the cars, right? Very unassuming. Sometimes people are nervous because they don't want all of their neighbors to know, I have this mobile crisis team coming. There are no sirens. There are no uniforms. They just arrive and try to be there to help. And the teams are pairs. There's one clinician and one of the people on the team is a certified peer specialist. Do you all know what that is, a certified peer specialist? That's a person who has experienced their own mental health condition or challenges. They have been in recovery, and now they've been trained, and they go through a very rigorous training in Chester County, months of internships and specialized training. So these folks are such a valuable addition to our mental health workforce locally. And really, they're nationwide too. We know there's a nationwide shortage of mental health professionals, and people who have experienced it get it. And so they are very helpful when someone's struggling. Here are some frequently asked questions. I'm probably just going to read the slide to you here. Do they call the police? No, not necessarily. As the officer said, if there's a situation that seems like that's necessary or proper, they will. But provides important connections to resources and referrals using the least restrictive means possible. And that's important for people to know. They're not going to call the police or call somebody to impose any restrictions if it's just not a danger or a concern. Hospitalization and police are used as a last resort. 988 calls are resolved by talking with the crisis workers. How does 988 decide who you'll talk to? Well, in Chester County, they've done a lot of work with 988 to try to make sure all the calls go locally to our Westchester contact center. So a lot of times that's through that's geo-routing, depending on the phone service. In Chester County, AT&T, Verizon, and T-Mobile all route by geo-routing. When routing by the area code, 988 contacts to the nearest 988 operator based on your area code. And we all have sometimes weird area codes because of our mobile phones, right? So if you have a different area code, and you don't have T-Mobile, AT&T or Verizon, it's possible you might go outside in Chester County, but you can tell them you want to be connected to Chester County. Oh, okay. Okay, no, it's fine. How much do you have to pay? Nothing, zero. This is absolutely a free service. And, you know, a lot of times when people, if there's a physical problem, and you think someone may need an ambulance, and you call them, and if they get in that ambulance, it's going to cost, they're going to get a bill, right? Someone has to pay for it. But 988, the mobile crisis team, there is no fee at all. And if the person does want to go to the hospital, mobile crisis can transport, not involuntary, right? But if someone is willing to go and wants to go to the hospital for help. Is 988 confidential? Absolutely confidential. It may be anonymous too, which is going to kind of have an impact on the exceptions there. But if it is a situation where there's imminent safety concerns, then they may send someone out. And yes, you may stay anonymous. They may ask you for information. You are not required to give it. So we use this just to, sometimes people will say, I'm confused. When do I call 988? When do I call 911? And here are lists for either side, you know, mental health, substance use, suicide prevention, crisis de-escalation, any of that stuff, and any kind of medical emergency, any kind of safety thing, crimes, fire, all of that, you will call 911. So who's part of the Human Needs Network? Well, this slide, and I can give you the slides too, that might be helpful as well, but Open Behavioral Health, they are the employers for all of our crisis counselors. They also continue to run the Valley Creek crisis in Exton, and it has the warm line number up there as well as the hours of operation for, okay, that's the hours of operation for the warm line. Then they give us information on who runs the mobile crisis teams. That's through Woods Legacy Treatment Services. Chester County employs the 211 call takers and all of the mobile navigators. And all of the people in the Human Needs Network are contracted through our Department of Human Services. They really oversee the whole operation. Some of the other resources in Chester County, I mentioned the ACES Coalition, and when I can follow up to send the slides on a PDF, and I can provide a resource sheet with the websites for these different organizations and resources. ACES, as I said, they have a lot of free trainings. They're wonderful. They can be virtual, little lunch and learns, or they can come and provide larger trainings. NAMI is a national organization that is relatively new in Chester County too. It's located in Exton. Do you all know about NAMI? They're contracted through the Office of Mental Health. That's a national advocacy organization, education advocacy, wonderful people to work with. And they're in Coatesville quite a bit. They work with the Health Alliance, used to be the Brandywine Health Foundation.
Alliance for Health Equity,
Sorry?
Alliance for Health Equity.
Alliance for, there you go, that's it. They have a lot of trainings, a lot of information opportunity. They have support groups, 3 support groups for people who have the mental health condition and for families. The Teen Talk Line, I have little papers up there. That is open and free for any kids to call. Again, I said we have a mental health crisis among young people. So that is open daily, Monday through Friday. We have a monthly electronic newsletter called My Meet Health. That's free. It has all of the local happenings, any upcoming trainings, any big events. The Suicide Prevention Partnership, as I said, they do a lot of prevention trainings, do a lot of events in the community. Child and Family Focus is another organization contracted through the county. They provide respite care for families who have a family member, a young person with a mental health condition. And a lot of times families just need a break. They need a little help. And so that is a free service through the county's Office of Mental Health. And I mentioned mental health first aid is a certification training. It's about 8-hour training, but as I said, it's a great certification. I mean, it's good for people to put on their resumes. And we offer those trainings regularly. I have one tomorrow through the hospital, Chester County Hospital, but we offer them at least once a month. Anyone have any other questions? Did I cover what you wanted to learn or know? Hopefully I didn't cover things that you've already know about, but I do have, please feel free to take, these are flyers for the Human Needs Network, and we have them in Spanish as well. Like one of those. I need to get to Exton to get more NAMI flyers, but here's at least one if you want to keep it, and I'm sure the website is on here. There's a QR code. Human Needs Network cards, please take them. This is for people who may be concerned about immigration status, that sort of thing.
Great.
Did you have any other questions? Is this what you expected? It's always
Yeah,
such a vast,
It's
thing.
huge. It's such a huge topic, and we'll talk with staff and see if there's interest in maybe doing more in depth on something. I just think it's important to remember, we all have our individual things that we're dealing with. Like you said, mental health can impact anybody, but we also work in a community that is, probably a higher percentage of some of these issues as well, just because of the fact that we live in, an area where people are just dealing with a lot of things, and that impacts us on a daily basis also. So,
It does, yeah. And it's important, that's why, I've enjoyed working in this field with education, because the more informed the community, the healthier everyone is, because we can sort of support each other and guide, our friends, neighbors, loved ones, or people in the community or the public who come to the resources they need. There are a lot of things available.
it's helpful to know all these resources are available, and hopefully our staff, we can kind of, just having these as something that we can just hand off, encourage people to call. I always like to remind people also on a personal level that we do have our employee assistance program too. If our employees need to pick up the phone and
Absolutely.
ask for help too. So
Yeah, I mean, I talk about the employee assistance programs quite a bit, even in mental health first aid. If there's ever one of the people from human resources in the room, I always make them promise it's not going to go on your personal record if you call. That's sometimes people get concerned about that. So, but it isn't. It's wonderful. If you have it, you should use it for sure.
So much, Tracy.
Thanks. And if anyone has any other questions, please feel free. I'll hang out for a second.
Thank you.
Thank you.